Sounds sounds good. Just really quick, can everyone hear me okay?
Yes.
Okay, good. I was having like a second of issue when I hopped on, and I was worried that was gonna be the whole time, but we can give it another minute, just 2 minutes after noon. I want to be like respectful of everyone's time, but at the same time, give people a moment to settle in. April, how are you today?
I'm wonderful. How are you?
I'm good, thank you very much. Um, if you would like to, or if you would like, I can introduce myself first and then you can introduce yourself. That sounds good.
Sure.
So, well, my name is Katie Ryan. I am with the Early Careerists Committee with ACHE of Indiana. I work for Ascension St. Vincent in their supply chain department, and very happy to be moderating today. April, would you like to introduce yourself?
Sure. So my name is April Grudai. I am the faculty program director for the Master of Science and Healthcare Management degree in Bloomington, Indiana.
So with that kind of kicking us off, we can get right into the questions we have prepared for today. And just so everyone knows, we'll have about 5 to 10 minutes at the end of our prepared questions for people to pipe up and ask questions. I'm sure, and April, you can tell me if I'm wrong. If anyone has anything to quickly ask in between, you can feel free to raise your hand and come off mute. But to start us off, April, can you share a bit about your current role and your leadership journey in healthcare?
Sure. So I'm going to start this question off with a bit of a personal story, and I promise it'll answer your question. But a leadership journey is more about job titles, right? It's about the journey itself. So I want to share a little bit about how I got to where I'm at. So when I came out with my master's, I moved into a coordinator role at IU Health, which is very common with new grads, whether they have a bachelor's or a master's, right? Is to start into that coordinator role within a health system. And so I did HIV education at IU Health for about 2 years and then moved into a pharmacy coordinator role. And when I started the pharmacy coordinator role, I was 2 to 3 years in post graduation and I was super hungry to get promoted, right? Like I'm a high performer, I'm ready, I want the next step, I want that leadership role. And so I was working 50 to 60 hours a week and I was taking any project that was mentioned in any meeting I was in. I was like, oh, I got that, I'll eat that, sure, give me whatever you got, right? So I was developing new trainings. I was coordinated a reaccreditation of a PGY1 program. I helped get new accreditation for 5 additional PGY2 programs. I got IU Health as an entity accredited to provide pharmacy CE. And so I'm living my best life, right? Like I got married and had a baby. Best life excluding like come home, make dinner, see husband, play with baby, put baby to bed, and then work for another 3 or 4 hours, right? But I wanted to make an impression and I wanted to impress people that mattered. Then my husband had a sudden cardiac arrest. And for those of you that are unfamiliar with heart conditions, only 5% of people who have a sudden cardiac arrest outside of a hospital live. He was he had no heartbeat for 25 minutes and received high quality CPR. So this was a really serious incident. And after the cardiac arrest, things got better for a while and then they started to rapidly deteriorate. He ended up going into the hospital and was in the hospital for 194 days. And at this point, I was no longer thriving, I was surviving, right? So he wasn't getting better. I was actively watching him die and was kind of at a standstill in my life. And they said, there's nothing that we can do. He needs a heart transplant. So he went on the heart transplant list. And I was fortunate enough that I was there when we got the call that he had a heart, that they had a heart for him, and they were going to do his transplant at midnight. And so me being the type A person that I am, I got an Excel spreadsheet out and I listed all of our friends and family and everybody that would want to visit with him before he went back at midnight, and had everything well coordinated. And I have to say that the process was actually beautiful, of people coming in and saying, this is what you meant to me and this is how you impacted my life, and him being able to share how they impacted his life. And it was really a good reset on like what matters in your life. At that time, our daughter was 9 years old, 9 months old. And I have to say that it was really hard listening to him read his goodbye letter to her. That one was difficult. And then we said our goodbyes and we talked about all the things that we didn't make time for before. Like we wanted to go kayaking in the Everglades, and we wanted to ride horses in Glacier, and we wanted to go camping at Yellowstone, on all the things that seemed like we had all the time in the world to do before, and how we were going to do these with his second chance at life, right? So they wheel him away and to begin his surgery. And I won't lie, I hit my knees and I realized that no matter what the results of the surgery were, that things weren't ever going to be the same for us, right? At that time, life expectancy for heart transplant patient is 7 years. And so in order to make sure that even if things go well and to honor the donor family, I realized that I had to figure out what was important to me, right? Like, who am I? What's important? What does that look like? So I spent the next 9.5 hours that while he was in surgery doing just that. So I figured out, what is my personal mission statement? What is important to me? What are my values? And from that moment have used that mission and value statement as the guiding light for every major decision that I have made personally and professionally since then. So he came out of his surgery beautifully. We are now 11 years post-transplant. We are living our best life and hitting all of those bucket list items. But this is where it comes back then to my leadership journey and how I got to where I am. So my mission is to live a fun and adventurous life in which the people around me feel deeply seen and heard, and to develop transformational healthcare leaders. It is the essence of who I am. It is why I am here. It is what I do. It is where I am. It's where I thrive, right? So when Dave came home, so I have a husband who's recovering and I've got a 9-month-old baby, and I now know what I'm meant to do, but I no longer have 50 or 60 hours to prove my capabilities and to get the experience that I need. I've got a tight 40. And so what does that look like, and how do I use this as my guiding light? So from there, I joined, knowing that I wanted to develop transformational leaders, I joined the Office of Transformation. So for some of you that you might know it as OpEx. And from there, I started to develop those leadership skills. So I learned lean and process improvement and operational excellence, and worked my way up to developing transformational leaders by helping the entire system redesign their emerging leaders program. I was responsible for all of the lean trainings across 35,000 employees and 17 hospitals. I helped develop a change management framework for the hospital, coaching execs around strategic deployment, individual leadership trainings, all of these things that are filling my cup, that are directly in alignment with who I am and what I want to be, right? But I realized at that point that I was having a great impact in my hospital, but I wasn't impacting anyone outside of my hospital. So if I wanted to transform healthcare, it had to look a little bit, healthcare leadership, it had to look a little bit different than that. So from there, I created my own consulting company, and with that was able to create some training and development, strategic coaching services for local hospitals and some other healthcare entities. And last year was able to expand my reach. So I was contracted with USAID and the US Embassy to create a strategic plan for redesigning how the Ethiopian healthcare systems work, and how they go from the government paying to being autonomous and patient paying. So now I've got in my healthcare leadership development, I'm filling my cup from a perspective of one hospital. I'm now helping other hospitals, and I'm helping medical device, and I'm helping across the nation. But I realized that I still wasn't filling my cup around developing transformational healthcare leaders at that entry level or mid-level point, right? So I was thinking strategically about how do I make sure that I'm filling my cup around that. And that's when I had the honor and privilege of developing the Master in Science and Healthcare Management degree program at IU Health. And so this program then is developing those transformational leaders and those skills, either those that are residential coming straight out of undergrad, or those mid-level leaders creating an online program that skills them up so they're able to have real skills that they're able to immediately apply as part of like a leadership development phase of healthcare companies. So that's kind of my journey from coordinator to consultant to faculty program director.
Thank you so much for sharing that, and especially sharing your personal story. I think that, you know, one day something life-changing will happen to each and every one of us. And I think that, you know, that grounding experience and recentering your values is really important to do in those moments, and also to know your values going into those moments. So I think that it really that you have a really unique leadership story, and it was really interesting to hear. Our next question is, what advice would you give to early or mid-career professionals aspiring to executive leadership?
So at this point in my career, I have probably coached now in the thousands of early and mid-career professionals, as well as those that are in the director and executive levels around like this leadership development. And I think that the step one starts with know yourself, right? Going back to every moment is precious for every single one of us, and doing things that are not in alignment with our values or who we are or how we want to show up isn't worth our time. So I would say to any leader is like, first, what are your values? What is your mission? Why are you here? What is important to you? What tasks or projects fill you up, like fill your cup? And what is it that's draining to you, right? Because like I'm an amazing project manager. I can run a project. I can take care of all the details. It exhausts me. It does not fill my cup to do that. I love to create. I love to do strategy. So it's not specifically that I don't have the skills. It's what makes me happy, right? So know what it is that makes you happy. And healthcare is big, right? So we typically think of healthcare being hospitals, but you've got hospitals, you've got medical device, you've got pharma, you've got consulting, you've got insurance, you've got long-term care. Like there is a breadth of opportunity out there. So find what it is that aligns with your cultural values. What kinds of places have offered the kinds of experiences that matter to you and connect to you? And when we start to figure out what those big executive dream jobs are, then find the job descriptions, right? So what is it exactly that they're doing? What industry that you want to be in? So now you know who you are, you know where you want to be. Step three then is reverse engineering your life. So now you know what you want. A lot of people let their careers happen to them, right? Like this opportunity came up, this kind of landed in their lap. That's not how you get to executive leadership, right? And it's not how you get to executive leadership doing things that fill your cup and make you happy. People who are connecting their mission and their vision and their values to their work do so because they intentionally create those things. So how do we reverse engineer your life? Is number one is find people um, who can help you. So find people that can help you figure out what skills and experiences are necessary to get your dream job. So one of my superpowers is my network, right? Like I know lots of different people. So find those people. Find the people that have your job title that you want, asked to meet with them, learn about their day to day. What does their job look like on a daily basis, on a weekly basis? What skills do they use? What experiences did they have to get them to that place? and make a list of those skills and experiences, right? So it could be that you need direct reports, or you need to be able to manage a budget, or you need to be able to lead people through change, or whatever those things are. And then find a mentor or five to help you figure out where you are and how to get there. So how do your current skills align with those goals? How do your current experiences align with those goals? What's the logical progression of skills and experience to get there? You're probably not going to go from a coordinator to a COO. So is there already a career path in place in your organization that's going to help you get there? Do they already have succession planning? What organizational support is there? And if you feel safe, if your supervisor is supportive, tell them that you want to be considered a high performer and ask them what that means. I have been shocked with the amount of times that the employee versus the employer's expectations of what great means are two totally different things, right? So ask them, what does great mean to you and how do you measure it? Get the metrics and then discuss those in every one-on-one meeting. This is what I'm working to. How am I getting there? And ask them for feedback on how you're doing. So with your mentor, then you can ask for feedback on your utilization of specific skills. You can ask them to connect you to people that they know who could provide insight on the career ladder. So it's more than just showing up and being like, okay, mentor me. Like, it's intentionally figuring out what those questions are. So once you've done your soul searching, right? You know who you are and what's important to you. You know what kinds of jobs are going to make you happy. You've developed relationships. You're getting feedback and coaching. Now is when you're going to be strategic and create that 3 to 5 year plan, right? So what are the 3 to 5 year, in the next 3 to 5 year, what are the skills that you need to develop? What are the experiences that you need to have so that you can demonstrate them to get you where you're at? Now, I will say that how you show up professionally in this progression really matters and can open up doors that you've never considered. So, for example, 5 years ago, I had a student that did a practicum placement for design and construction at IU Health when they were building their new hospital in the South Central region. And he did such a phenomenal job that last week I was in a meeting with the COO and their directors, and his name came up around the work that he did and how he showed up. And it was discussed. His preceptor ended up opening up her own consulting firm. She, to this day, will discuss the work that he did. So know that leadership isn't always about formal titles. It's about the influence that you're extending and the impact that you're having on others. So based off of the amazing work that he did and his work ethic, the COO knows his name. The people across the hospital know the work that he does. He's created a network of people who are willing to support him and go out of their way to help him just by working. Now, on the flip side, we have executives in the room too. We have directors and people that are leading. And so my coaching around this is going to be about creating those experiences for your high performers, right? So what formal and informal networks do you have for mentorship? And how are you supporting them, right? Because being a mentor or a mentee is its own skill set that has to be learned. So people have to learn how to ask those thoughtful questions, how to give critical feedback, and how to accept critical feedback. A lot of our high performers tie their value to their performance, right? And so giving feedback that is less than stellar can be devastating. So how do we provide that feedback in a way that connects, and how do we reinforce that they haven't done anything wrong, that they're learning and growing? How to reflect is a skill. I thought that reflection, like self-reflection, was something that people just naturally knew how to do, but it's not. It's a skill set, and it has to be taught and reinforced and coached. And sometimes our direct supervisors aren't always the best people to do this. And so the execs and the directors, I want you to think about what networks do you have in place? What career pathways do you have to support these? And what training journeys or one-off trainings do you have to support both your mentors and your mentees as they're going through the process? So is it emotional intelligence? Is it coaching? Is it change? Is it lean? Is it project management? Making sure that you have a good strategy and training and support in place so we're not losing our high performers and they're supported and staying in our network. So that was a whole lot to the one question.
Yeah, but I think that, that really is the core, like what advice you would give for early and mid careers. That is the core of what I think most people on this call want to hear. And I think, like, personally, I found a lot to take away from what you were saying. So I'm sure that um, everyone else was very happy to hear that explanation as well. Um, this will be the last question that I'll probably ask from our prepared questions, and then I'll open it up to everyone else just to get their turn as well. So what emerging trends do you think healthcare leaders should be paying close attention to?
So I think that complexity in healthcare and leadership it's no longer the exception, right? Like it's the default. And leaders have to be ready to operate in that reality. So I think a few key trends that I'm watching is that our workforce has changed and we have workforce instability and redesign, right? So what our workforce looked like 20 years ago is different than what it works like now. And when we're having workforce reductions. And so leaders have to rethink roles. So we spend a lot of time talking about our clinicians working at the top of their license. How are we supporting the rest of our team to work at the top of their capability as well? And not only are we training them up to work at the top of what they can do, we also need to look at their workflows. So are they working in the most efficient way possible? Is there waste that we can get rid of that makes their job a little easier? What support systems do we have in place to retain? I think we're also looking at a shift from clinical excellence to systems integration. So it used to be that if we were providing an amazing care to our patients, we could keep our doors open. But it's not that simple, right? So we now have to have leaders and people who connect operations and finance and policy and people and lead across all of these, right? I think data fluency as a leadership competency is also one that I'm looking at. So it used to be that we had data analysts, like we had those people. And when I needed that done, I would call those people. It isn't working for us anymore. Every leader needs to be able to interpret the data and ask better questions and use it to drive decisions. I think we've got policy volatility that is something that we really that have to be on our radar, from national legislation to payer contracts. The policy landscape is shifting fast, and leaders need to know how to track it, anticipate it, and influence it. And we really need to focus on our communication skills then from top to bottom around all of those things. So we need to make sure that we're understanding people's issues, that they feel seen and heard, that we're giving them the opportunity for the people who do the work to be able to come up with solutions, and that we're just not dictating them down, and that we're really empowering them to make change. And so I don't think it's any one of those things specifically. And of course, we can't have any of those without just like mentioning AI and how that's changing the healthcare. But I think all of those things are kind of the trends that I'm watching for as we're prepping new leaders.
Yeah, absolutely. I think, we are in such a time of like extreme change, and a lot of it is anticipating that change. You can't really know what's coming next, but you need to know how to pivot. Um, so with that being said, I'm going to open it up to anybody to come off mute, ask a question. They can put it in the chat if you're feeling maybe a little bit shy. Um, and I'm trying to see if I can see if anyone is raising their hands, but we'll give it a
Hey,
minute or
Katie,
so.
I will come off of mute and I just want to say hello, Katie. April, I miss you, miss you, miss you. Appreciate you. I don't have a question, but um, April, I just wanted to say for everyone on this call that everything you've heard April talk about, it comes through in her work as a program director for the Master of Science and Healthcare Management program. I was one of her students in the second cohort of that program. And I feel like because of that program, I have thrived in my time post program. And so, no question for me. I just wanted to come on and say, April, I miss you. And then just to let everyone know that what you see from April here is what you get. That's what comes through in this program. And so, you can really see a reflection of her in this program. And so, if there's anyone out there who's thinking about jumping into this program, please do it. I think it'll benefit you in the long run. And so that's all I wanted to. I'll step off my soapbox now. So
I'm happy to see your
Thank
face, my
you.
friend.
it's good to see you as usual.
Thank you so much, Cheris. Sydney S., I see that you have your hand raised.
Hi, can you hear me okay?
Mhm.
Okay. Um, First off, thank you guys for putting this on. And April, I just wanted to mention real quick, just thank you for sharing your personal story about your husband. I think it is those moments in life where we self-reflect and then we find ourselves becoming stronger from those moments. And I've actually worked in organ and tissue donation since 2021. So happy to hear that your husband is doing okay and he was able to make it through that. I know that can be such a scary situation for you and for him and all your family and friends. But thank you so much for sharing that story and just letting us know kind of how you took that and made it into who you are now. So I can't think of any questions off the top of my head. I'm one that I might think of questions later, so hopefully I can reach out later for questions. But I just wanted to say, like, thank you for sharing that personal story.
Thank you for doing what you do.
Thank you. It's a it's a difficult space because, like you mentioned, you think of the donor families, but also you think of the recipients. So I've been on the phone with families and have had those conversations about donation, and it's very difficult, but also can be very rewarding. So thank you so much for sharing that.
Thank you so much, Sydney, for acknowledging, that and the work that you do in uh, tissue and organ donation. We have another question in the chat that just says, what are some things to do and keep in mind to start a career in healthcare management?
So I think outside of what was already mentioned around networking and knowing what you are and um, who you are and why you want to be here, I would encourage you to really look at all of the opportunities because healthcare is vast and different areas do require different skill sets. And so trying to figure out which area speaks to you and what types of things fill your cup. So operations is very different from HR, which is very different from, practice administration, quality assurance. I mean, all of these things are very different aspects of the hospital that a lot of people don't think about. So I would encourage you to meet with healthcare leaders and learn about the different areas because unless you have opportunities to explore these things, you wouldn't even know that some of these departments exist within a hospital until you get in there. So I would recommend to really explore what makes you happy and what's available.
Absolutely. And I also wanted to just point out, Corey just wrote in the chat, but I think for anyone that is like me, where questions come after reflection, after a little bit of time, we have April's email in the chat, and then also a link to the different opportunity or the opportunity of the MSHM program at IU. Yes, IU. I almost said IU Health. Um, and I know that 12:30 was the end of this meeting. April, I'm sure that we could talk to you for hours more and get so much more insight, but I'll let everyone get back to their day. And thank you so, so much for your time.
Thank you all. Yes, if you have questions or want to get involved or want to talk more about leadership development at your org or you're interested, let me know. I am happy to chat. Thank you so much for your time and spending your half hour and lunch with me. And to my alumni, I'm so happy to see you. Thank you for coming and supporting me.